My husband, who had always taken care of himself because he wanted to live past 63, because his dad died at 63, I noticed a bump on his neck.
Celine Rivers lost her husband Jim when he was just 63.
They diagnosed it as anaplastic thyroid carcinoma. Generally anaplastic cancers are fast-acting, fast-growing. They gave us 12 weeks.
Celine and her family found comfort and support dealing with the devastating news that their loved one was facing a life-threatening illness from the compassionate staff at Spartanburg Regional Hospice.
Hospice care is the very best sort of care for people with advanced disease, with serious illness, who are approaching the end of life.
Spartanburg Regional Hospice offers comprehensive care with highly trained physicians, staff, and volunteers, working together to meet each patient's and family's unique needs. The majority of patients in the hospice program are offered help and managed at home.
In the beginning, when we knew that he was going to be on hospice care, even before we came to the hospice home, the nurses came, set up the house because he had to have oxygen, and so they set up the oxygen and everything. They helped everything in the home work well, and then when we had to transfer over here, we had new nurses here, but it transitioned very well, and it really helped us to let him go.
When patients are ready to transition from care at their home, Spartanburg Regional Hospice offers a special purpose hospital. It provides intensive care for various symptoms from qualified physicians and teams of nurses.
Most of the folks that come in here could not be managed in the home setting. And that's the reason why they're here, because we have nurses that are adept at managing complex symptoms, physicians here all the time, physician visit every day, the capability to do just about any sort of complex symptom management that needs to be done.
The private rooms here are large and comfortable. The hospice home offers a unique home garden with its peaceful outdoor patio access and hiking trails. Patients and families can also take advantage of massage and music therapy.
The best thing about that was that when we got here, instead of a caregiver, I could be his wife. And at that point in time, I needed to be his wife and not just someone that had to do all the things that were necessary with his feeding tube and his trach and medicines.
I've been here 2.5 years, and there is just something special about this place. There's a sense of peace that prevails that makes people feel better almost when they roll in the door.
Well, they did treat him with dignity. They were very respectful to him. Every person that came in the room that was on the team here helped us get through each step. And when he left here, they played It Is Well With My Soul, and everyone came to the hall and stood there in respect of him. And I think you look at these other families and you see people that are going through the same thing you are, and the quality of the care that was here.
Again, I think it's just the fact that we're all focused on really one thing, and that is making everybody feel the best they can feel in a difficult situation, have the best quality of life. The least suffering is the other way of looking at it.
I think probably the most important thing to me is that he was allowed to be who he was. He was allowed to live until he died.
Compassion and quality care, meeting the needs of patients and their families. Spartanburg Regional Hospice.